So up to now we have discussed introducing the culture of patient safety. Number 2, building capacity for patient safety. Number 3 was reporting incident and learning systems. Now, how to integrate the concept of patient safety into clinical practice. And this is one of the important components as well. It involves ensuring that the evidence-based practices are used consistently across all the healthcare settings. Standardization is the key in integrating patient safety into clinical practices. And that is the core concept कि आप अपने procedures को and treatment को standardize कर दें. What we commonly see is that we are doing कि मेरा experience है या ये हमने सीखा है अपने बड़ों से, that is not the way to go forward. It is always evidence-based practice and you standardize the protocols to improve the patient outcomes and make the system less hazardous for the patient. Standardization involves development and implementation of the protocols, guidelines and checklists to ensure that the best practices are followed consistently. By standardization of the clinical practices, healthcare organization can actually reduce the risk of errors and improve patient outcomes. What we'll learn? We'll learn that why integrating patient safety into clinical practice is important, what are the challenges, what are the strategies that can be utilized to integrate patient safety into clinical practices, success stories, and we'll conclude the core component for that. As healthcare providers, our ultimate goal is to provide the best possible care to our hospitals. However, we must also prioritize their safety. Patient safety is not just important aspect of clinical practice, it should be an integral part of it. Integrating patient safety into clinical practice and routines will improve patient outcomes, reduce medical errors, and enhance the overall quality of care. It is also crucial to recognize the significance of patient safety and take proactive measures to ensure that integration into our clinical services is done. This requires a culture shift, and culture shift is the first core component of the WHO Action Safety Plan, where the patient safety is prioritized and it becomes a shared responsibility of all healthcare providers. And by doing so, we create a safer environment for our patients and ultimately improve their overall healthcare experience. The fourth component is all about integrating the patient safety into clinical practice. And by incorporating it, we make sure that all the aspects of clinical practice is covered, and that is from the initial assessment to care delivery and follow-up as well. Integrating patient safety requires a multifaceted approach that involves the healthcare provider, the patient, and their families. It involves creating a culture of safety where everyone is encouraged to speak up about their potential risks and hazards, and where there is a commitment to continuous improvement and learning. Why to integrate? Well, by implementing evidence-based practices and fostering safety culture, healthcare provider will definitely reduce the medical errors and enhance the care. Healthcare providers can save money on malpractices and claims and avoidable readmission by reducing the medical errors. So it's all about incorporating the patient safety culture into the clinical practice, and we can do that best by following the evidence-based medicine and making the guidelines and protocols in view of the latest available knowledge. Challenges. The biggest change for any new thing is, again explained in the previous components as well, is resistance and number 2 resources. And for resistance, we have already explained once that to overcome any resistance, we need communication, collaboration, and persistence and perseverance. Resource allocation can only be done when the leadership takes patient safety as a key component or important aspects of healthcare. And once that is done, then investment into training, investment into infrastructure, and the quality improvement initiatives will be taken, and that all will be centered around the patient safety and improving the patient outcomes. So, strategies for integrating patient safety in clinical practices. And the first most practical things for integration is just following the evidence-based medicine. And when you do so, you are actually following the guidelines and the latest research to make clinical decisions for your patients, and that will decrease the chances of medical error as well as improve the patient outcomes. The second important strategy is, as already discussed previously, foster a culture of safety within the healthcare organization. This means creating an environment where the staff feels comfortable in reporting the errors and near misses, and where there is focus on continuous quality improvement. By prioritizing safety in the healthcare providers, we ensure that the patient safety remains the forefront of our clinical practice. Engaging patients in their care is also important in promoting the patient safety. And this involves providing education and resources to help patients understand their condition and treatment options, and as well as involving them in a shared decision making about their care. So by empowering the patient to take an active role in their care, healthcare providers can help promote better outcomes and reduce the risk of adverse effects. Success stories. So one healthcare organization successfully integrated the patient safety into their clinical practice in a large hospital based in New York. What they did, they implemented a system of double checks for medication administration, which significantly reduced the medication errors and improved the patient outcomes. And in addition, they established a culture of safety by encouraging staff to report near misses and adverse effects without the fear of retribution. And this led to a better identification and resolution of the safety issues. Another community health center related success story was in Alabama. They implemented patient safety rounds where the staff members from different departments would visit a patient room together to identify the potential safety hazards and implement intervention to mitigate those risks. This approach led to a decrease in the falls and infections, as well as improved communication among the staff members and the patient. Now to the fifth component of the WHO Action Plan for Patient Safety, strengthening medication safety. The fifth component of the WHO Action Plan is strengthening of the medical safety, and which involves reducing the risk of medication errors, which are the leading cause of patient harm. Medication reconciliation and other strategies can help to improve medication safety. Medication reconciliation involves comparing the patient's current medications to the medications they were taking before admissions to the hospital. This helps to identify any discrepancies and prevent medication errors. The other strategies that can improve strengthening medication safety include computerized orders by the computerized order entry system, barcode medications administration, and pharmacist-led medication reviews. So we'll discuss the scope of medication safety, the impact of medication errors, strategies for improving medication safety, challenges to improving medication safety, the role of healthcare providers and the role of healthcare organizations. The consequences of medical errors can be devastating, leading to the patient harm, increased healthcare cost, and decreased trust in healthcare provider. As a healthcare professional, it is our responsibility to ensure that we are doing everything possible to prevent these errors from occurring. There is potential for improvement in medication safety, starting with the awareness and action. By implementing strategies such as medication reconciliation, computerized physician order entry, barcode medication administration, we can significantly reduce the risk of medication errors. It is up to us to take this initiative, and we can make differences in the lives of our patients. And हमने अपने उस सेटअप में अभी देखा भी है कि आस्ता आस्ता कंप्यूटराइज्ड इंट्रीज जो हैं, प्रिस्क्रिप्शन इंट्रीज जो हैं, वो बहुत से प्राइवेट क्लिनिक्स में और गवर्नमेंट हॉस्पिटल्स में इंट्रोड्यूस हो गई हैं. एंड द सोल पर्पस इज़ के आपके चांसेस ऑफ मेडिकल एरर्स विद कंप्यूटराइज्ड एंट्री कंपेयर टू हैंड रिटन प्रिस्क्रिप्शंस कम हो जाते हैं. What it emphasizes that for medication safety you need an effective communication, collaboration and coordination among the healthcare providers, patients and the other stakeholders. The core component 5 also stresses the importance of using evidence-based medical practices and technologies to reduce the risk of medication errors and improve the patient outcomes. So what is the scope of medication safety? So we know that there are various areas where the safety can be improved. It starts from prescribing the medication, where selection of the appropriate medication for patient is based on the basis of medical history, current condition and other factors. Then we go down to dispensing, which the area which needs to be improved, which involves ensuring that correct medication and the correct dosage is provided to the patient. After dispensing comes the administration, and that needs ensuring that the medication is given to the patient in the correct manner at the appropriate time and to the appropriate patient as well. And after administration, the next step is the monitoring of the medication, which involves tracking the patient response to medication as well as looking for side effects and making adjustment if needed. So impact of medication error. Medication error can have devastating effects as already explained. The patient may experience adverse reactions or interactions from the medications he is already taking. He can receive incorrect dosages and can be given wrong medication altogether. In addition to the human toll, medication error can also result in increased healthcare cost as well as decreased trust in healthcare providers. Patients who experience medical errors may require additional medication treatment, resulting in higher cost for both the patient and the healthcare services. Furthermore, the patient who has experienced a medication error, may be less likely to trust their healthcare providers later on, leading to decreased satisfaction level and potentially lower adherence to the treatment plans. Strategies to improve medication safety? Well, as already discussed, one is medication reconciliation, which involves comparing the patient current treatment that is given to the hospital to the treatment that the patient was taking before he was coming to a hospital. This process helps prevent adverse drug reactions and improve patient outcomes. As already hinted before, So another strategy is computerized physician order entry, which involves using electronic system to prescribe medications. It minimizes the risk related to handwriting or incorrect doses, as well as provide decision support for healthcare providers as well. Challenges, well, as for previous components, one is resistance, and for resistance you need persistence, collaboration, and communication. And you have to remind again and again that what the new system beholds for the patient. Another challenge is lack of resources, as improving medical safety often requires investment in the new technologies, staffing, and other resources. However, many healthcare organizations operate on tight budget and may not always have the fund to do so. So finding creative solutions to address resource constraints is essential for making progress in this area. What will be the role of healthcare provider? Well, it is vital. They have a vigilant role. They must be vigilant for potential errors. They must communicate effectively with their patients and other providers and advocate for patient safety. And by doing so, they can prevent medication error and ensure that the patient receives the best possible care. One way to improve healthcare provider in terms of medication safety is being aware of the medications of their patients already taking, as discussed in medical reconciliation. This includes knowing about their allergies and also about their adverse effects, as well as any other medication that patient may be taking, like Hakimi medication, over-the-counter medication. Usually our patients are using those as well. So providers should also communicate clearly with the patient about their medication, including how it is taken, what time to be taken, and what side effects they should be watching out. Finally, providers should report any medication errors or near misses to their organization in the safety reporting system. What is the role of health organization? So, as already says, unless there is a leadership commitment, so none of the core, if there ain't any leadership commitment, none of the core components can be achieved. So, as leadership is required for implementing the policies and procedures that promote safety, organization can only reduce the risk of medication errors or improve patient safety if the leadership is on board. In addition, policies, procedures, healthcare organization can also create the culture of safety that emphasizes the importance of medication safety. This can include regular training and education for the staff, as well as open communication channels that encourage reporting of the errors. By creating the culture, which is the first core component of the WHO action plan for patient safety, the organization can empower the staff to take action or be involved actively in improving the patient care and medication safety. In conclusion, in terms of the fifth core component of medication safety, we have explored the different aspects of medication safety, the negative impacts of medication error, strategies that can be utilized to improve medication safety, and challenges that need to be overcome, along with the individual role of the healthcare providers and organization role in promoting patient safety. It is clear that a lot of work needs to be done, but we should not be discouraged by the complexities of the issue. Rather, we should be motivated by the potential positive change that our actions can bring. By working together and remaining vigilant, we can make significant progress towards improving medication safety and enhancing the quality of care that is provided to our patient. So now we come to the sixth component, that is ensuring surgical safety. The sixth component of WHO Action Plan for Patient Safety is actually ensuring the surgical safety for the patient, and it involves reducing the risk of surgical complication and errors. Surgical checklist and other strategic measures can help improve surgical safety. Surgical checklists involve a series of steps that are followed before, during, and after the procedure to ensure that all the necessary precautions are taken. Other strategies for improving surgical safety include team training, use of simulation, and implementation of protocols for high-risk procedures. So we'll study why surgical safety is important, the three pillars of surgical safety: teamwork in surgical safety, number 2, communication in surgical safety, and number 3, creating a culture of safety. These are the three pillars of surgical safety. Surgical procedures are often seen as routine. Every year, millions of people will undergo surgery. While most of the procedures are successful, but still many cases will come up with complications related to procedure, even fatalities. That's why WHO has included surgical safety as a part of its action plan for patient safety. And the consequence of going an unsafe surgery can be devastating both for the patient as well as their families. From infection to organ damage, there are the potential complications that can arise during a surgery. That's why it's crucial to ensure that the surgical procedures are carried out safely and effectively. Sixth core component of the WHO Patient Safety Action Plan, while dedicated to surgical safety, aims to ensure that every patient who undergoes surgery receives safe and effective care. And to achieve this goal, WHO recommends a number of strategies. As discussed, they include checklists, implementation and standardization of protocols, the promotion of teamwork and good communication among the teams. And by following these recommendations, healthcare providers can reduce the risk of errors and complications during the surgery, leading to better patient outcomes. So, as already discussed, that why surgical safety is important, as it can bring harm, emotional harm, or physical harm to the patient who has gone through an unsafe surgical procedure. Furthermore, unsafe surgery can have a far-reaching effects beyond the individual patient. It strains the healthcare system, increases the healthcare cost, undermines the public trust on the healthcare system, and that makes it crucial for the health providers to prioritize surgical safety and take every possible step to ensure safe and successful surgeries. The three pillars of surgical safety: number 1, teamwork; number 2, effective communication; and number 3, creating a culture of safety are utmost important. Teamwork is critical in the operating room, where the surgeon, nurses, anesthetists, and other healthcare workers work together seamlessly to provide the best possible care to the patient. Effective communication is also crucial. Clear, concise communication can prevent errors and ensure that everyone is on the same page. Teamwork is crucial. It involves effective communication, collaboration, and coordination among all the members involved in the surgical team. One effective way of teamwork is the WHO's surgical safety checklist. This checklist ensures that all the team members are aware of the critical steps in the surgery process and communicate effectively to prevent any harm. Communication in the surgical safety. Effective communication is crucial to any process, and that will hold same for the surgical safety as well. Clear, concise exchange of information between the team members, such as surgeon, anesthetist, and other professionals, before, during, and after the surgery is of utmost importance, and this will prevent the errors and it will ensure that everyone is on the same page. Same as previously, for good communication as well as it was for the teamwork, checklist is very important. Checklists can help standardize the procedures and ensure that none of the important steps are missed. They can also serve as a reminder to the team members to communicate important information such as allergies or other medical conditions before surgery. As explained so many times for other components, core components as well, the incorporation of culture of safety, patient safety into the health system is of utmost importance. And creating a culture of safety is crucial, ensuring that surgical procedures are performed with the highest level of care and attention to all the details. This involves clear protocols and guidelines for all the aspects of the surgery that include again preoperative preparation to the postoperative care. We usually take surgery just on the operating table. That is not the case. When we come down to surgery, it's from the initial planning to the post-op follow-up. All the steps are very important. And creating the culture of safety fosters an environment for open communication. And collaboration between the members of the team is of utmost importance as they are working together and they are sharing information. And when they do so, they identify the potential risks and they can take the steps to ensure that no harm is done to the patient. The final core component is improving infection control, and that involves reducing the risk of healthcare associated infections, which can have serious consequences for the patient. Hand hygiene and other strategies can help improve infection control. We'll go through the impact of infection on the patient safety, create strategies for improving infection control, barriers to improving infection control, and we'll discuss some success stories. Infection control is integral part of patient safety, and we have experienced it firsthand in COVID-19 pandemic as well. And it is crucial that we understand the importance of it, as infections can lead to prolonged stay in the hospital, long-term disability, and even death. The good news is that many of the infections are preventable through simple measures such as hand hygiene and environmental cleaning. So, we have seen that infections, healthcare associated infections, are emerging as a sort of new pandemic. And they are causing prolonged hospital stays and increased burden on the healthcare system. By implementing effective infection control measures, healthcare facilities can reduce the risk of infection as well as overall cost of the treatment and improve patient outcomes. Infections have devastating effect on patient safety and healthcare systems. Patients who acquire infections will receive long-term antibiotics compared to a person who has not, and it increases the mortality as well as morbidity, increases the hospital stay, and even lands the patient into intensive care. And the toll of hospital acquired infections is significant as the economic cost due to it increases significantly. Furthermore, infection can spread rapidly within the healthcare facilities, putting both the patients as well as the healthcare professional at risk. It is of particular concern in the era of antimicrobial resistance, which can be both difficult to treat and pose a serious threat to the public health. It is essential that healthcare facilities prioritize the infection control measures to prevent the spread of infections and protect both the healthcare providers as well as the patients. Key strategies for improving infection control: hand hygiene. It's the simple and one of the most effective way to prevent the spread of infections from within the healthcare settings. Healthcare providers should be washing their hands frequently with soap and water or use alcohol rub. Vaccination is an important strategy in preventing the illnesses. All the healthcare workers should be vaccinated, and vaccination should be done at the community level via public health. Environmental cleaning is essential part of infection prevention and control. Surfaces and the equipment should be cleaned with disinfectant regularly, especially in the area of high risk like patient rooms and operating rooms. What are the barriers? The first barrier is resources. In the healthcare facilities with limited budgets, it is often difficult to get the necessary equipments and supplies needed for effective infection prevention and control. These include hand sanitizers, gloves, personal protective equipments, and environmental cleaning supplies. The other factor that is a barrier in infection prevention control is staff compliance. Even when the resources are available, it is challenging to ensure that all the staff members are following the protocols of infection prevention. This can be due to a variety of factors, including lack of training, constraints, and competing priorities. Well, success stories are a lot regarding hand hygiene, and we did witness it somehow in COVID-19 as well. But in one hospital, the hand hygiene program was introduced and it reduced the hospital-acquired infection rates by around 50%. And the program included education and training for all the staff, as well as monitoring and feedback to encourage the compliance with hand hygiene. Another health facility improved infection control by implementing antimicrobial stewardship program. This involved monitoring of antibiotic use and prescribing practices to reduce the antibiotic resistant infections. As a result, the facility saw significant decrease in the number of patients with healthcare associated infections. As discussed, infection prevention or infection control is a critical component of patient safety and requires a collaborative effort between the healthcare providers, healthcare organization, patients, and their families. We must implement the key strategies of hand hygiene, vaccination, environmental cleaning to improve infection control. However, we must acknowledge the common barriers such as lack of resources and staff compliance. Despite these challenges, there have been success stories in the healthcare facilities who have implemented infectious control measures and they have seen positive impact in patient safety. Implementation of the WHO Action Plan for patient safety requires a multifaceted approach. One of the main challenges is the culture and the mindset of the healthcare providers and the organizations towards prioritizing the patient safety. And this involves addressing issues such as hierarchy, communication barriers, and resistance to change. Another challenge is we have to take all the stakeholders on board. That includes patient, their families, healthcare providers, healthcare organizations, policymakers, and regulatory bodies. Because each stakeholder has a unique role to play, from feedback to implementation of the evidence-based medical. Despite these challenges, there are opportunities, and every new thing comes with new opportunities. So we have new technologies and advances that can help us in achieving patient safety. We can increase the awareness and education of the public and health providers to promote the culture of safety in our setups. Collaboration between different stakeholders can also lead to much more effective and efficient implementation of the changes. And overall, what will happen at WHO, if properly applied, there will be impact of WHO Action Plan for Patient Safety. And evidence have shown that implementing the key components of the action plan, such as leadership, patient engagement, safety culture, education and training, has led to reduction in adverse effects and increased patient satisfaction level. In one study in Japan, where the plan was implemented, there was 44% reduction in medication errors, 35% reduction in fall, and 20% reduction in healthcare associated infections. And almost the same results were actually seen in other countries as well. So there is significant impact if the plan is applied properly. In conclusion, what we have learned in this lecture was about WHO Action Plan for Patient Safety and its key components, including leadership, patient engagement, safety culture, and education and training. We also discussed the burden of health errors and importance of prioritizing patient safety. And now it's up to all of us to take actions towards improving patient safety in our own healthcare settings. Thank you so much.